The poorer you are, the more pain you feel. People with lower socioeconomic status are more likely to suffer from spinal pain, experiencing greater disability, and have worse treatment outcomes. Hello, I'm Jeon Jung-won from Flowam. When we look at recent healthcare research, we encounter a troubling reality. The lower a person's social and economic status, the more likely they are to develop spinal pain, suffer from several symptoms, experiencing disability, and even face poor recovery outcomes. And this isn't just an opinion. The research is remarkably consistent. According to a 2018 study published in The Lancet, individuals from a household earning less than $20,000 per year were 2.29 times more likely to experience persistent low back pain compared to those with higher incomes. The same study found that patients experiencing financial stress were 39 times more likely to follow a worsening pain trajectory over time. In contrast, individuals with higher levels of education 46% lower risk of developing chronic pain and disability. The evidence is clear. Health outcomes are not determined solely by biology. They are heavily influenced by the social environment in which people live. And this problem extends far beyond spine pain. The pattern is also visible in dermatological conditions. Research published in 2025 and earlier findings from JAMA Dermatology demonstrated that individuals with lower socioeconomic status face a higher risk of conditions such as atopic dermatitis and hidradenitis suppurativa. A 2021 study published by Wiley reported that as nations become wealthier, the burden of musculoskeletal disorder among adults over the age of 50 tends to increase. South Korea, in particular, showed a prevalence significantly higher than the global average. Taken together, these findings suggest something important. Many health problems are not simply the result of laziness, poor discipline, or bad personal choices. Instead, structural and environmental factors often play a much larger role than we realize. So what can be done? If someone is born into a less favorable environment, are they destined to suffer poor health outcomes forever? Fortunately, the answer is no. Access countless medical studies, researchers consistently identify a small group of individuals known as positive deviants. These are people who achieve exceptional health outcomes despite facing the same disadvantages as those around them. When researchers examine their behavior, certain patterns emerge. Many engage in regular physical activity, often exercising at least 3 times per week. Others countlessly educate themselves about health and wellness, maintaining health habits despite financial and environmental challenge. Of course, not everyone has the time, resources, or knowledge to navigate their overwhelming amount of health information available today. But there is reason for optimism. The rise of online communities and digital education has made access to quality health information more available than ever before. At Flowam, we believe health should not be limited by income, geography, or circumstance. Rather than simply telling people to try harder, we aim to create systems that make health choices more accessible. We're building an online ecosystem where individuals can access high-quality health guidance, establish sustainable routine, and support one another regardless of their financial or environmental limitation. We envision a future where social status no longer determines health outcomes. A future where anyone, regardless of their background, can become one of those exceptional individuals who overcome the odds. This is the future Flowam is working to create. If you share this vision, we'd love for you to follow our journey. Thank you for listening. I'm Chun Jong-won from FlowM. Thank you.